question this week of can chiropractic help with back pain? And I thought I'd take a moment and answer if it can or not. The answer, of course, is yes. And how exactly that chiropractic does help with back pain. Interesting enough, back pain is one of the top 3 reasons that people come to see me in the office, along with neck pain and headaches. So the top 3 things would be neck pain, headaches, and back pain that people come to see me for in the office. Now, there's a lot of other conditions as well, too, that chiropractic is great at treating and helping. Those just happen to be one of the top 3. Now, can chiropractic help with back pain? Absolutely. We see excellent results with patients with back pain. The first step is we do an examination, and all chiropractors should do a very thorough examination to make sure, first and foremost, that the care is appropriate for you and that they can address that care in a manner that will correct the problem that's causing that pain versus just masking it or temporarily covering it up. So the first thing that we look at is we look at the bones in the spine. So as many of you know, your spine is made up of 24 movable individual vertebrae, and then at the bottom is the pelvis made up of 3 bones, 2 ilia and a sacrum. The bones of the spine look like this. So as you can see, we have 2 vertebrae here, which are separated by a disc. Okay, the purpose of the bone is to protect the spinal cord and the nerve beginnings. And those nerves branch off to the spinal cord, and that's how the brain controls everything, like the muscles and the joints, etc. And the spinal cord is running through the center, and the spinal nerves branch off the side. So the vertebra is a hard casing that protects that. The disc, think of it like a spacer. It holds the bones apart so that the bone can pass through, or the nerve can pass through the bone. Without the disc there would be no space for that nerve, or very little space, and there'd be compression on the nerve. Okay. The disc is also a pivot point. So this is a lumbar vertebra out of the low back, one of the 5 bones in the lower back. And the lumbar vertebra move like any of the vertebrae. So this is the back side. So this side would be the left and this side would be the right. When a patient leans to the left, we should see the bone tilt and rotate. And when they lean to the right, we should see the same thing occur. Tilt to the right and rotate. Okay. What a chiropractor is looking for is evidence of a subluxation. A subluxation is where one or more of these bones have shifted out of their normal position, and instead of protecting the nerves, they now put pressure on it, damaging it and causing that pain. So if the bone shifts out of normal position, puts pressure on that nerve, that's a subluxation. That's what could be causing the pain. Now, if that's left untreated, things can change. So one of the first things that we see with a subluxation is loss of that normal movement. Of those 4 movements of the bone, when there's a long-standing subluxation, we may lose 1 or more of those motions. Okay, we can feel some of that during an examination. We feel for swelling. We feel for tenderness. We may use temperature differentials using certain instruments to measure temperature on one side of the spine versus the other. And then we also take a look at the spine, looking for deviations in the spine or abnormalities. In the end, we can shoot an x-ray. In my office, I specifically highly trained in motion study x-rays, one of a handful of offices in the country that do these. And we can measure how many of those motions or those movements are lost. Now that tells me how much function is lost, and then we can determine about how long the problem's been there and confirm those problem areas, make sure that what we're feeling is congruent with what we see on the x-ray. And the benefit to the patient of that is we can be very specific with our treatment to zone in on exactly the problem areas and get that problem fixed so they're not dealing with it for the rest of their life. Then on that motion study, that tells us on that information specifically what areas to treat, how much function probably can be returned, and about how long that's going to take for the patient so we can give them an estimation of how long care may last. For those of you that know me, you may know that obviously I wasn't always a chiropractor. Matter of fact, the reason I became a chiropractor is because one helped me. I was a patient first. I used to work in law enforcement, specifically street-level drug and gang enforcement. And one day I actually got injured on the job. I got knocked over by a car and ended up damaging my low back. A chiropractor did a similar exam on me, and he was able to help me and kept me from having spine surgery. And I was very scared at the time, afraid that I was going to have spine surgery, and it was very close to having to have that. And that's been a long time, and chiropractic saved me from having to have spine surgery and haven't had a problem with that since. So if you're suffering with back pain, or you know someone that's suffering with back pain and they're looking for a natural solution, avoiding drugs and surgery, I suggest that they seek out a chiropractor and set up a time to do a thorough examination to see if chiropractic care would be right for them to help solve their problem.